Hello and welcome to lyranara.com and lyranara.me, and today we're going to talk about a myriad of conditions that are known as joint, bone and muscle diseases such as rheumatic diseases, arthritis, etc. that affect us especially as we get older. And in this presentation we're going to discuss the real causes of these inflammations that produce pain and impair your mobility. And I guess the most important thing that we're going to discuss is that it is healable. Contrary to common knowledge, it's not only that you can suppress the symptoms such as pain, you can really heal it, and you're going to learn why that is, why this is not a bunch of autoimmune diseases as many believe. And in the next presentation, of course, we're going to talk more in depth about true healing of those diseases. But first, let's discuss how you develop those diseases and what you can do about it not to even develop them in the first place. Without further ado then, let's get started. And first, of course, we need to establish the definitions of arthritis, arthrosis, and rheumatism. And according to the WHO, a rheumatic or musculoskeletal condition, they comprise over 150 diseases and syndromes, which are usually progressive and associated with pain. They can broadly be categorized as joint diseases, physical disabilities, spinal disorders, and conditions resulting from trauma. Musculoskeletal conditions are leading causes of morbidity and disability, giving rise to enormous healthcare expenditures and loss of work. And the conditions with the greatest impact on society include, first, rheumatoid arthritis, which is a chronic systemic disease that affects the joints, the connective tissues, the muscle, the tendons, as well as your fibrous tissue. It tends to strike during the most productive years of adulthood, so between the ages 20 to 40, and is a chronic disabling condition that often causes pain and deformity. The prevalence varies between 0.3 and 1% and is more common in women and more common in developed countries. Within 10 years of the onset, at least 50% of the patients in developed countries are unable to hold down a full-time job because of this disease. Second is a disease called osteoarthritis, which is a degenerative joint disease, which mainly affects the articular cartilage. It is associated with aging and will most likely affect the joints that have been continually stressed throughout the years, including your knees, your hips, your fingers, and the lower spine region. Osteoarthritis is already one of the 10 most disabling diseases in developed countries, and the worldwide estimates are that 9.6% of men and 18% of women with an age over 60 have symptomatic osteoarthritis. 80% of those with osteoarthritis will have limitations in movement, and 25% cannot perform their major daily activities of life. Other rheumatic disorders currently recognized by the WHO include back pain, arthritis, arthrosis, bursitis, tendinitis, capsulitis, neck pain, osteoarthritis, as well as palindromic rheumatism, and many, many more. As we said, there are over 150 diseases and syndromes which fall under this category. Today, classical medicine considers most of the rheumatic diseases to be autoimmune disorders. So, ankylosing spondylitis, relapsing polychondritis, systemic lupus erythematosus, rheumatoid arthritis, gout, inflammatory arthritis, juvenile arthritis, Sjogren's syndrome, scleroderma, polymyositis, dermatomyositis, as well as psoriatic arthritis, all are considered to be autoimmune disorders. And a total of 75 million Americans have those so-called autoimmune disorders that are inflicting damage on their bodies. That's far more than people affected by cancer, which are approximately 25 million in the US, or by heart disease, which are also around 25 million. Scientists aren't sure why, but the number of autoimmune diseases have sharply increased over the last 2 decades. So is that really so? Your doctor will give you a treatment plan consisting of medication that blocks the immune system in order to address those conditions, or a specific step in the immune pathways in order to slow down the damage that is being inflicted by the immune cells on your body. The drugs that are used to suppress the immune cells are the kind of poison that rapidly dwindle the immune cells, and the new autoimmune drugs are part of the multi-billion-dollar industry, and they aren't cheap, with prices ranging from $1,000 to $45,000 a month. The expenditures that people have to endure is very, very tough, and they have a hard time affording them. And these drugs also come, of course, with side effects ranging from mildly annoying fatigue, mouth sores and heart palpitations to life-threatening infections and many, many more. Thousands of studies have demonstrated that all autoimmune conditions are a complex interaction of the person's genes and its environment, known as epigenetics. 95 to 98% of the risk of getting autoimmune conditions is due to your lifestyle. So especially what you eat and drink, your stress levels, how much you exercise, and what you're exposed to every day, from agricultural chemicals and industrial toxins to air and water pollution, electrosmog, as well as emotional and psychological stress. So the major cause of these autoimmune disorders is your unhealthy lifestyle. The health and vitality you desire requires an optimal environment for your cells, and therefore you must follow these rules. First, consume a nutrient-dense diet that avoids foods you react negatively to. You must also reduce your toxins exposure and burdens by regularly detoxing. Activate and use your muscles by performing fitness. You must control your stress hormones, so you must achieve a psychosomatic balance. You also must maintain or build connections with supportive people, so take care of your social life. And you must educate yourself about your alternative holistic medical options, and that's what we are here for. These inexpensive and comparatively small steps are the most effective way to reduce symptoms of nearly every chronic disease that afflicts modern society. We must stop blaming our genes or invent autoimmune disorders or live in a permanent anxiety and keep defending ourselves from invasive microbes or use medication as a crutch for our poor health. If you have a poor health, you must first and foremost change your lifestyle and address through the main cause why we become ill by this. And this treatment is free. None of the autoimmune therapy really works. All will make you sicker. So start with your lifestyle. What are the symptoms of joint and bone conditions? Well, all joint and bone disorders start with a sluggish and dysfunctional digestive system as a result of overeating and overdrinking the wrong and toxic kind of food. So food that is not properly digested, and many poisons and wastes, they accumulate in your entire organism and preferentially in your connective tissue. And excess of fats and proteins generate also excess of mucus that is clogging the internal layers of the intestines where the food is absorbed. Morbid bacteria created by rotten food develop foul gas in your intestines, which spreads into your entire body, impairing thereby your metabolism, your blood circulation, which will slow down, and you will lose a lot of energy to maintain the body in working condition. People are freezing and are downhearted also often. Gout, one of the rheumatism diseases, appears especially in individuals who often consume all kind of tasty delicacies, so sweets, and have a soft and voluptuous flesh body. The mucus multiplies so much that it becomes impossible to restrain it. Finally, lactic and uric acids are stored in your legs and feet, where they are changed into slime, and such a person has then strong pains in his or her legs and feet, and with time will become even unable to walk. Women suffer seldom of gout, as they excrete these juices through menstruation. Once in menopause, gout also finds its way into females though. How do you get sick with rheumatism? Well, different beliefs, habits, as well as traumatic emotions are stored in your brain during your entire life. The older you get, the more unresolved conflicts are accumulated, and to each conflict you will develop brain edemas. Brain edemas communicate and control specific organs which are becoming impaired. The autonomic nervous system and the hormonal system are thereby dysregulated, and after years and years, different organs degenerate and begin to malfunction. The most affected ones are the gastrointestinal organs, and all joint and bone disorders are the result of a bad and insufficient digestion, replaced mostly by a fermentation and lactic acidosis process. Also, toxins from your environment, food, water, air, and soil, as well as electrosmog, penetrate your body and disturb thereby the cellular polarity of your cells and thereby the cell communication. Psycho-emotional and epigenetic factors, together with homotoxins and the wrong habits, such as overeating and overdrinking, will bring the body out of homeostasis, and your autoregulation processes will not function properly anymore, which means the cells will lose their polarity, the membrane potential is decreasing, and you become chronically sick and morbidic. Not even 5% of elderly people can reverse their joint and bone diseases because the applied therapy is wrong. And if you understand this, you will also understand how to become healthy. Let's talk a little bit more in depth about tissue inflammation and degeneration. Before the age of 40, your cells can easily regenerate, but after your 40th birthday or thereabouts, the cell's healing and regeneration potential is significantly reduced and decreases with aging. Your body talks to you through the language of pain, inflammation, stiffness, benign and malign tumors to attract your attention that this is your last minute operation or chance to change your lifestyle. Diseases are therefore biological programs of nature to trigger your attention to solve your life problems and your psycho-emotional conflicts to change your lifestyle. Hildegard of Bingen, a well-known healer of the 12th century, explains rheumatism as following. Rheumatism causes are directly connected with the struggle of life, fear, and emerging disturbances of metabolism, triggering of disbalance of the body fluids, which she called tumors, and these are due to overeating and overdrinking. She called rheumatism a kind of life paralysis. What about your musculoskeletal system? Well, the skeletal system includes all bones and joints in your body, which are ligaments, tendons, cartilages, the connective tissue, plus the muscles that connect and stabilize your bones. Bones, together with your joints, muscles, and the connective tissue, allow for controlled physical movement and a correct posture. They also provide protection for many of the body's internal organs. The bone marrow inside the bones produces most of the blood cells, including the erythrocytes, which are the red blood cells, and the leukocytes, which are the white blood cells, and the thrombocytes, which are the platelets. Most bones of the limbs contain mainly yellow bone marrow composed mostly of fat. However, if the body suffers large amounts of blood loss, yellow bone marrow is converted into red bone marrow to ensure blood cell production. So-called osteocytes, which are mature bone cells, and osteoblasts, which are immature bone cells, are the major bone cells. Osteoblasts are bone-building cells that also form the calluses required for bone repair. The outer surface of the bones is covered by the so-called periosteum, except the joints and the sides attached to the ligaments and tendons, which are capped with cartilages. The firm cartilage surface reduces friction during your joint movement, and the cartilage is covered by the so-called perichondrium, the equivalent to the periosteum lining the bones. The embryonic skeleton is mainly made up of cartilages which gradually are replaced by bones, and this process is called ossification and completes only after birth. So let's talk about one of the main causes for all of these disorders, and this is the so-called self-devaluation conflict. Taking into consideration how you get sick, what we took a look at in the previous slides, all diseases start with a psycho-emotional conflict, and based on the ontogenesis of organs developed and described by the so-called German New Medicine, it becomes obvious that all joint and bone diseases are the result of this so-called self-devaluation conflict. And what can this conflict be? Well, first, it can be a generalized self-devaluation conflict concerning the whole person. The conflict is experienced through humiliation, accusations, scolding, derogatory remarks, physical, sexual, and verbal abuse, failure at work, in school, in sports, in your relationships, as a parent or partner, a poor intellectual, artistic failure, athletic performance failure, or feelings of shame and guilt. The loss of a status, the loss of a workplace, retirement, illness or injuries, which mean that you feel like you are out of commission, aging process, which makes you feel like I'm not as good as I used to be, I'm getting old and useless, or the loss of a person who made you feel appreciated and needed, are all other very serious conflict scenarios. And the way we perceive ourselves or speak to ourselves, like for example, if you tell yourself, I'm a failure, I will never succeed, create mental predispositions for generalized self-devaluation conflicts. Children and the elderly are more vulnerable to suffer those kind of conflicts, and this is why it is very, very important that you take care, especially in the young and the elderly, that they don't develop these feelings. Or they solve them, of course. A localized self-devaluation conflict exists also, and this relates to a specific part of your body. A poor artistic or athletic performance, for example, corresponds to your hands and legs. A self-devaluation conflict brought on by a cancer diagnosis like colon cancer, prostate, or breast cancer. A negative prognosis, like you won't be able to walk again, a removal of an organ, for example a mastectomy, or continuous localized pain correlates to the nearest bone or joint in your body. In comparison, a moderate self-devaluation conflict would involve the closest lymph node or muscle. Whether the conflict affects a bone or joint on the right or the left side of your body, or both, is determined by a person's handedness, so if you are left or right-handed. We need to also understand that our musculoskeletal system is controlled by the so-called cerebral medulla. In line with the evolutionary ontogenesis, self-devaluation conflicts are the primary conflict themes associated with cerebral medulla-controlled organs deriving from the new mesoderm. The bones, the muscles, the lymph vessels, as well as the lymph nodes, the blood vessels and the connective tissues, and the fat tissue share the same brain relays and therefore the same biological conflict, namely a self-devaluation conflict. The control centers of all components of the musculoskeletal system are orderly positioned on the medullary cortex, as you can also see in the picture on the right. Bones and joints, including your cartilages, your tendons and ligaments of the body right side, are controlled from the left side of the brain. Bones and joints on the body's left side are controlled from the right cerebral hemisphere. Hence, there is a crossover correlation from the brain to the organ. Pain is the punishment signal of your body because you feel guilty and have no value and you are self-devaluated. So arthritis, bursitis, tendonitis, fasciitis, and all those other itis disorders are inflammations of specific parts of the structural system, and these inflammations put pressure on different nerves or trigger shortening of muscles that are related to different joints. The muscles become therefore tight due to emotional and physical stress first and foremost. Also, each part of the musculoskeletal system has its specific self-devaluation conflict content. This will trigger in your medulla oblongata a brain edema and corresponding to the location of this edema, a part of your musculoskeletal system will get an anatomic and physiological impairment. So skull and the cervical spine, the problems here stem from an intellectual self-devaluation conflict. The conflict could be triggered by failing an intellectual task, for example at school, at work, by having made a mistake, or by condescending remarks of teachers, coaches, employers, your colleagues, a parent or your partner, making a person feel slow or stupid in general. People who have an occupation that is intellectually demanding, so scholars, academics, writers, and many others, whose self-worth is built therefore on their intellectual achievements or who are academically overambitious, are more susceptible to experience this type of conflict. Self-talks like I am an idiot, I am not smart enough can generate a self-inflicted loss of self-worth, and the fear of failing might already activate this conflict. Also, unexpected injustice, so where you feel that this is not fair, also affects the skull and the cervical spine. Problems with your facial bones can stem from a self-devaluation conflict that concerns your look or your reputation. Problems with your orbital eye sockets stem from a self-devaluation conflict related to your eyes, for example after surgery where somebody tells you you look like a monster. Problems with your jaw bones come from not being able to bite, literally or figuratively. Ossicles and the mastoid in the ear problems here come from a self-devaluation conflict associated with hearing impairments, so not being able to grasp information. Shoulders, humerus, which is your upper arm, and the collarbones problems here stem from a relationship self-devaluation conflict, so having failed as a partner, as a parent, as a son, daughter, a colleague, a friend or a teammate, often in association with guilt and blaming oneself, also not being able or not being allowed to hold, embrace or hug someone. Poor performance, let's say in sports, also affects the shoulder as it is the joint of action. Problems with your elbows stem from self-devaluation conflicts that involve the elbow, for example in sports, or playing a musical instrument or work-related activities. Also, not being able to embrace or hold a person or a pet is associated with elbow problems. Wrist, hand and finger problems, so dexterity conflict causes that is caused by a failing manual task or by a poor manual performance. People whose self-confidence relies predominantly on their manual achievements, whose occupation requires fine motor skills, like surgeons, dental hygienists or jewelers, as well as finger dexterity, like typing, needlework, playing a musical instrument, are more likely to suffer this type of self-devaluation conflict and therefore those types of problems. Problems with your ribs and your sternum come from a self-devaluation conflict that is prompted, for example, by a breast cancer diagnosis, a mastectomy, or a heart condition. Thoracic and lumbar spine problems stem from a central self-devaluation conflict that shatters the core of oneself, like humiliating and degrading treatment, The lower back is also associated with feeling unsupported, so not backed up by a family member or your partner, your friend, your teacher, your colleague, or your employer. Cancer diagnosis related to the area of the thorax, like for example lung cancer, or the lumbar spine, like for example prostate cancer, kidney and colon cancer, or constant pain such as abdominal pain and menstrual pain affect also the closest vertebrae. Pelvis and pubic bone problems come from a so-called sexual self-devaluation conflict, which might derive from sexual abuse, erectile dysfunction, not performing as expected, finding out that your partner is having an affair, sexual rejection, feeling devalued, below the waist, not being able to become pregnant, miscarriages, hysterectomy, prostate cancer diagnosis, prostate surgery or urinary incontinence could also provoke this type of conflict. Coccyx, which is the tailbone, and the sacrum problems come from a self-devaluation conflict that is associated with your buttock, tergo sex perceived as humiliating, pain during intercourse, as well as local symptoms such as hemorrhoids, chronic diarrhea, and vaginal dryness. Problems with your ischial bone come from an inability to process something, like we figuratively sit on what belongs to us in order to secure it. We are unable to sit something out. We are not able or allowed to sit on one's place, like your desk, your car, your bike, your motorcycle, your horse. The conflict could also relate to a person we want to possess or seize. Hip and femoral neck problems stem from not being able to endure a situation because of unexpected or continuous demands, like when you're telling yourself this is too much to carry, I can't manage, I cannot get through this. The femur is also linked to a physical performance conflict. Knee and lower leg problems come from a physical performance conflict, for example, difficulties walking or climbing stairs, not being able to keep up, poor performance in sports, like when you lose a game, you're being put on the reserve bench, humiliating remarks by your instructor, not performing up to your own standards or expectations, or the expectations and standards of your coach, parent, or spouse. Feeling less mobile also during pregnancy or because you have gained weight. And feet, ankle, heel and toe problems come from not being able to walk, run, jump, dance or balance, not being able to kick someone away in defense. The underside of the heel is also linked to not being able to crush a person or a situation. It is also very important to understand that your musculoskeletal system is linked to your gastrointestinal organs. So the muscles contract or relax under control of the nervous system to perform a movement. If certain muscles have impaired circulation, they become weak on contraction, and if muscles have impaired lymphatic drainage, they become stiff on relaxation. You may not even notice this at first, but the uneven tension across the joint causes the joint to move off course, and your mobility will be affected and you will feel pain because of that. Impairment of your muscles crossing or linked to a specific bone or joint is also related to one or more gastrointestinal organs. As discovered and documented by German New Medicine, the digestive organs are diseased if you cannot digest a morsel because it is difficult to accept. The so-called morsel conflict may become the root cause of a joint and bone disorder, therefore. If a traumatic event in your life cannot be digested, the corresponding muscles related to your stomach, your intestines, your liver, your pancreas are also being affected, and the digestive organs will develop different diseases such as cancers, ulcers, dysfunctionalities, etc. The related muscles, joints and bones are affected as well. pain and a limited mobility may evolve, as well as arthritis, osteoporosis, etc., which are the consequences of this. Thus, a secondary cause of joint and bone disorders is related to your gastrointestinal organ dysfunctionality, and this must be treated first. So let's dive a little deeper into these correlations and relationships between your musculoskeletal system and your gastrointestinal system. And first up is your knee and the small intestine relationship. How to diagnose the root causes of a knee arthritis. A knee pain associated with arthritis or arthrosis and reduced mobility, eventually bone to bone, may be the result of an impairment of your small intestine, your large intestine, your gallbladder, and your adrenals. Knee and small intestine relations are if the knee issue is associated with hip problems, manifested especially when you try to get up from deep knee bends, then it is the small intestine which is malfunctioning, and the muscles related to the small intestine and knee are abdominals and the quadriceps. The biological conflict linked to the small intestine is not being able to absorb or digest a morsel. The conflict is experienced as anger about a person, a family member, a friend, neighbor, colleague, employee, your supervisor, your client, teachers, students, classmates, coach, doctors, authorities, or a work-related anger, a school-related anger, relationship-related anger, or accusations, insults, criticisms, or news that are hard to take in general or difficult to digest. The small intestine conflict overlaps with the self-devaluation conflict corresponding to the knee, and the result is a lack of movement and sport performance. In the brainstem also, the control center of the small intestine, the jejunum and the ileum is orderly positioned within the ring which forms the brain relays which control the organs of the alimentary canal, precisely between the duodenum and the cecum relays. The relationship between your knee and your large intestine is as follows. If the knee pain and the reduced mobility is radiating in the hip and your lower back, then the morsel digestive conflict affects the large intestine, and the knee and large intestine relation is involving the muscles, which are the hamstrings as well as the quadratus lumborum and tensor or fascia late. Last is the reason also for most of the hip replacements. Your colon also is controlled by the brainstem. For humans, this conflict can be a figurative morsel conflict, for example, a dispute about a car, a house, or another valuable object. We might also perceive certain circumstances or unpleasant events as a morsel conflict and suffer the conflict when the situation is considered indigestible or non-absorbable. Let's say when an anticipated purchase or promotion or promise cannot be taken in. The distinctive aspect of the morsel conflict corresponding to the colon, including your appendix and the cecum, is that the conflict is experienced as particularly ugly. For instance, ugly fights over money or property, or ugly divorces, court cases, or betrayals. Next, what is the relation between your knee and your gallbladder? Well, if the knee problems are radiating in your shoulders, then the biological conflict is for a male. It is a territorial conflict associated with anger, and for a female it is an identity conflict, and those conflicts are related to your gallbladder. The muscles involved in this kind of biological conflict are your anterior deltoid and the popliteus. The organ affected is the gallbladder. The epithelial lining of the gallbladder is controlled from the right temporal lobe, which is a part of the postsensory cortex. The control center is positioned exactly across from the brain relay of the rectum lining, as you can also see in the pictures on the right. The gallbladder, the bile ducts, the stomach, the pylorus, the duodental bulb, and the pancreatic ducts share the same brain relay and therefore the same biological conflict. A severe conflict can affect all of the organs at once, and polyarthritis will affect several joints. Many times we treated left knee pain and arthritis symptoms, sometimes bone on bone has been performed by us by treating first and foremost gallbladder issues. There is also a relationship between your knee and your adrenals. So when knee problems are manifesting with additional calf cramps and plantar fasciitis, then your muscles such as the sartorius, the gracilis, the soleus, and the gastrocnemius are involved, and these are linked to your adrenal glands. The adrenal medulla consists of the same cells as the intestinal epithelium and originates from the endoderm and is therefore controlled from your brainstem. Major biological conflict is the unbearable intense stress in this case. The adrenal cortex forms the outer layer of the adrenal gland, and the adrenal cortex produces hormones, mainly stress hormones such as cortisol and aldosterone, as well as the androgens. The adrenocorticotropic hormone, ACTH, regulates the levels of cortisol released from the adrenals, and in evolutionary terms, the adrenal cortex developed from the lymphatic tissue and originates therefore from the new mesoderm and is controlled from the cerebral medulla. Biological conflict linked to the adrenal cortex is having chosen the wrong path, being thrown off course, having gone into the wrong direction, and having made the wrong decision or the wrong choice. What about a bone syndrome known as osteoporosis? During the self-devaluation conflict active phase, the affected bone decalcifies, creating gaps and little holes in the bones, as you can see also in the lower picture on the right. And the location of the osteolysis, which is a bone breakdown, is determined by the exact type of self-devaluation conflict, and the degree of decalcification is a result of the intensity of the self-devaluation conflict. The decalcification of the bone increases the calcium levels, and the loss of bone marrow that occurs together with the bone osteolysis alters the blood parameters. A decrease in bone mass is also commonly called osteoporosis or brittle bone. Conventional medicine claims that osteoporosis is linked to a decline in estrogen production in women after the menopause. The theory of a correlation between bone loss and estrogen deficiency is, though, purely hypothetical, because there are postmenopausal women who don't have osteoporosis, and there are women who have osteoporosis before they enter the menopause. Men also get osteoporosis as well as do children, but men and children are not under the pressure to undergo regular bone density tests. They are not yet considered to fall into this so-called risk group. Osteoporosis in men is also played down as it doesn't fit a definition of a woman's disease caused by a lack of estrogen. Osteoporosis is a lasting, generalized self-devaluation conflict that affects most of your skeletal system. The steady bone decalcification is caused by continuous, often subtle self-devaluation that could be compared with dripping water, in line with the saying, constant dripping wears the stone. Based on the psyche-brain organ relation, osteoporosis in postmenopausal women has nothing to do with a reduced estrogen production or even a calcium-low diet, but rather with a woman's attitude towards aging and the changes that come with your menopause. So you feel less attractive, you feel no longer needed, or you have a low libido. In societies where women age naturally and without a Western anti-aging hype, older women, funnily enough, don't get osteoporosis. So the osteoporosis diagnosis and the fear of a crippling disease contributes to additional self-devaluation conflicts that lead to this chronic condition. Next, let's talk about osteosarcoma or bone cancer. Under normal circumstances, when a bone or a joint heals, callus also accumulates outside the bone, and to be precise, underneath the protecting shield of the periosteum. And the callus buildup, which you can see here in the X-ray, for example, on the right as a white area, forms a temporary natural cuff around the bone to stabilize the affected bone section while the healing runs its course. Yet in conventional medicine, the callus growth is considered to be bone cancer. A tumor in the femur or your pelvis or humerus or your ribs is generally classified as Ewing's sarcoma. If the periosteum seam ruptures because of an injury or an exploratory puncture, the callus finds its way through the open periosteum into the surrounding tissue, creating thereby a large so-called osteosarcoma. In conventional medicine, an osteosarcoma is considered a malignant type of bone cancer with a very poor prognosis. Without a puncture, the surrounding tissue would just have swollen somewhat, since only the fluid would flow out of the edema but not a callus. The process would have been similar to acute joint rheumatism that has a remission after a certain amount of time. Our experience shows that a brain CT scan provides much more reliable information about histological formations than any biopsy. In addition to creating an artificial osteosarcoma, the outflow of the callus into the neighboring tissue leads to a decalcification and eventually dissolution of the affected bone. In case of an osteosarcoma around the knee, this usually results in an amputation of the leg, and as long as the healing phase persists after an amputation, the bone pain continues as a so-called phantom limb pain, just as if the bone were still in place. With a puncture, a biopsy of the rib cage, the callus might escape into the breast, and a self-devaluation conflict related to the ribs is usually caused by a breast cancer diagnosis. If the hardened callus is found in the breast as a consequence of the rib puncture, it is usually diagnosed as a metastatic breast cancer, although the growth, in reality an artificial osteosarcoma, is not even adhered to the breast tissue. Mastectomy followed by chemo treatments are the standard therapies, and for women this is a reason of further self-devaluation conflicts. Also, a mediastinal osteosarcoma develops when the callus leaks out of a thoracic vertebra into the mediastinum. This is particularly dangerous since the hardened callus can compress the heart, the trachea, the lungs, or veins that supply the mediastinum with blood. Callus found close to the bronchi is often diagnosed as a small cell bronchial carcinoma. In reality, the small cells are callus. The best advice is to surgically remove the callus from the mediastinum to prevent further complications. Next up, the very widely spread bone syndrome known as rheumatism. What about rheumatism? Well, the periosteum covers the outer surface of all bones except your joints, which are capped with cartilages and sites that attach to the muscles, your ligaments and tendons. It consists for the most part of connective tissue and a sensitive network of nerves. The neural network of the periosteum has two layers, a lower layer which registers the pain caused by the swelling of a healing bone, and an upper layer that generates rheumatic pain. The periosteal nerves originate from the ectoderm and are therefore controlled from your cerebral cortex. The innervation of the entire periosteum originates in the spinal marrow of the cervical spine. The biological conflict linked to the periosteum is a severe separation conflict. Depending on the exact conflict situation, the separation might be associated with the arms, so not being able to hold a beloved person or a pet, your hands, loved one slipped away, your legs and ankles, wanting to push someone away, or your feet from a separation from the familiar ground through an unexpected move. Also, when a bone heals, the swelling expands the periosteal layer covering the bone. The stretching of the periosteum causes considerable bone pain since the periosteum is endowed with highly sensitive nerves. The pain is similar to the rheumatic pain that involves the upper layer of the periosteum and occurs in the conflict active phase of a severe separation conflict. Commonly, the condition is referred to as rheumatoid arthritis. Water retention also exacerbates the pain when the periosteum lifts from the bone. Due to the swelling, the bone loses its support and can easily break. Unless the bone osteolysis is severe during the conflict active phase, there is no real risk of fracture since the periosteum still covers the bone tightly. Bone pain is also a necessary part of healing because it forces the person to rest in order to prevent a spontaneous fracture, for example, of the femoral neck. If the spine is involved, it is strongly recommended that the patient stays in bed in order not to put stress on the spine and possibly break a vertebrae, resulting in paraplegia. The pain associated with the healing bone can take several months, even longer with conflict relapses. The better a person is prepared for the pain, the easier it will be to endure the temporary discomfort, and it is temporary. Recognizing that the pain is a sign of healing can prevent new self-devaluation conflicts that are triggered by the pain itself also. Next, let's talk about spine issues. A herniated disc or disc protrusion develops when the swelling tears the outer ring, which is called the annulus fibrous, of an intervertebral disc, with parts of the gel-like central portion, which is called the nucleus pulposus, bulging into the vertebral canal. The pressure on the spinal nerve causes acute pain, for example in the lower back, your lumbago, and with water retention the pain becomes even more severe since the retained water increases the swelling. Muscle spasms in the surrounding area are also caused by not being able to move due to the pain in the lower back. And when the periosteum stretches during the healing of a vertebra, this might look in an X-ray image like a protrusion of the disc. If the cervical spine, which is caused again by intellectual self-devaluation conflict, so if the cervical spine is affected, the pain radiates from the neck down to the shoulders, arms and fingers. Sciatica occurs when the swelling of a lumbar disc presses onto your sciatic nerve. Constant pressure on a spinal nerve, like hanging healing, can lead to serious nerve damage resulting in a loss of sensation in your lower extremities. So you can compare this with sensory paralysis, which is related also to the periosteum. In this case, preventative surgery must be considered. Swelling in the region of the plexus sacral is formed by the 4th and 5th lumbar nerves, so L4 and L5, and the 1st, 2nd and 3rd sacral nerves, and this causes pulling on the back side of your leg. Swelling in the region of the lumbar plexus, formed by the first 4 lumbar nerves, so L1 to L4, and the last thoracic nerve, T12, causes pulling on the front side of the leg and in your groin. A localized self-devaluation conflict involving the testicles, or testicular cancer diagnosis, for example, or removal of a testicle, affects the 2nd lumbar nerve, L2, and because before the testicles moved into the testicular sac, they were located just in front of the 2nd lumbar vertebra. A so-called sequestered disc is a fragment of the disc's nucleus that is no longer attached to the disc. This happens when the healing disc ruptures, for example, through lifting something very heavy. Also, when the healing process is constantly interrupted by conflict relapses, the recurring recalcification eventually leads to a deformation of the spine, which presents itself as a so-called scoliosis or lordosis, which is an exaggerated forward curvature of the lower spine, or a so-called kyphosis, which is a backward rounding of the upper spine, commonly also called hunchback. Juvenile kyphosis is also termed Scheunemann's disease. Spondylosis involves the vertebral discs, for example, the lumbar spine, as a result of a continual conflict relapse of a central self-devaluation conflict. If it affects the neck area, it is linked to an intellectual self-devaluation conflict, and this results in cervical spondylosis. So you can compare this with a stiff neck and torticollis related to the neck muscles. Spondylitis occurs when the healing process is accompanied by an inflammation. Next condition is the so-called trigeminal neuralgia, when the skull bone, again from an intellectual self-devaluation conflict, is healing. A big swelling might press onto the so-called dura mater, which are the outer meninges, resulting in a meningitis. With water retention as a result of an active abandonment and an existential conflict, the swelling can become quite large, and the condition causes severe headaches, particularly during the healing phase. Evidently, meningitis does not occur when the swelling, so the edema, is located on the outer surface of the skull. The X-ray shows bone osteolysis, visible as dark in the picture, in several areas of the skull, indicating a conflict activity with an intellectual self-devaluation conflict, or this is not fair conflict. In the early childhood, the condition is called rickets or weak bones. Rickets can also affect the arms, the legs, the spine, and your entire skeletal system. Usually it stems from a generalized self-devaluation conflict. The theory that rickets is caused by a vitamin D deficiency is pure assumption. Pain of the facial bones is also linked to a self-devaluation conflict that is associated with the face, for example, concerning your look, your reputation, presents also itself as the trigeminal neuralgia, since the face is innervated by the trigeminal nerve. Another very common disease of your musculoskeletal system is the so-called arthritis. And arthritis is the healing of a joint like a hip, knee, shoulder, elbow, or finger joint, accompanied by an inflammation. What is wrongly termed acute joint rheumatism, remember again, rheumatism is related to the periosteum, is the condition when the fluid in the edema, usually in the big joints such as the knee or shoulder, pushes through the cartilage into the joint, causing a transudative effusion. This is usually the case when water retention in the whole body is caused by kidney malfunction. Conflict relapses also increase the swelling. As a result, the joint becomes red, hot, and swollen. If such a swollen joint is punctured for exploratory purposes, this can create a large osteosarcoma. Swelling outside of the periosteum also occurs when the fluid of the bone edema leaks through the membrane of the periosteum. If this happens in the groin or in the area of the top of the femur, the swelling is often misdiagnosed as a thrombosis. Chronic arthritis also is a sign that the healing process cannot be complete because of a constant conflict relapse. With arthritis, a person is quickly in a vicious cycle, since the arthritic pain, so pain track, and a restriction of movements often causes additional self-devaluation conflicts at the same location. Sooner or later, this freezes a joint, for example, your shoulder joint. Polyarthritis, affecting many joints, reveals that the person has suffered the self-devaluation conflict as a whole. So it has become a generalized self-devaluation conflict. Also, the continuous alteration between decalcification, which occurs in the conflict active phase, and recalcification, which occurs in the healing phase, eventually deforms the finger joints. Continuous conflict relapses worsen the deformation because the buildup of more and more bone tissue, so hardened callus at this particular site. What about arthrosis? If the tendons or ligaments are affected by a self-devaluation conflict, the cell loss looks like soft tissue necrosis with an increased risk of injury since the weak tissue ruptures very easily. This happens with an Achilles tendon tear, which originates in a heel-related self-devaluation conflict. Prolonged loss of cartilage, for example in the knee or hip, is called arthrosis, also known as osteoarthritis, not to be confused though with arthritis that occurs when a joint is healing. A so-called Baker-sized cyst, also called popliteal cyst, is a cystic bulge in the back of the knee, as you can see also in the right picture, involving the joint capsule whose inner layer secretes synovial fluid. The main role of synovial fluid is to reduce friction between the joint cartilage during movement. The cyst forms when the production of synovial fluid increases due to the loss of cartilage or meniscus tissue that occurs during the conflict active phase of a physical performance conflict. Whether the cyst develops behind the right or your left knee is determined by the person's handedness and whether the conflict is a mother-child or a partner-related conflict. Carpal tunnel, tendonitis, and gout syndrome are next. Carpal tunnel syndrome occurs when the swelling of bones, ligaments, or tendons narrows the carpal tunnel, the passageway between the wrist and the hands, causing the median nerve, which reaches from the forearm into the palm of the hand, to become compressed. Hence, the typical symptoms of tingling, numbness, and sharp piercing nerve pain running from the wrist up to the entire arm. This syndrome is not a result of wear and tear, as many believe. Typists and dental hygienists are the professional groups with the highest incidence of carpal tunnel syndrome, but rather of a self-devaluation conflict, again associated with your hands. Wrist tendonitis develops after a dexterity conflict has been resolved. Calcified tendonitis of the shoulder occurs when calcium deposits form in the rotator cuff of the shoulder as a result of hanging healing because of conflict relapses. The conflict is a relationship self-devaluation conflict. Tendonitis affecting the elbow relates typically to sports activities such as tennis, having played a bad game, hence the term tennis elbow. Bursitis is an inflammation of the bursae, the cushions between a bone and the surrounding soft tissue. It usually occurs close to the joints, such as the elbow, knee, hip, or shoulder joints, depending on the specific self-devaluation conflict. With water retention due to the kidney collecting tubulus, arthritis becomes gout. The elevated uric acid levels give rise to the belief that a vegetarian or low purine diet would alleviate the pain. It is rather the underlying abandonment and existential conflict that has to be addressed though. Gout in the joint at the base of the big toe is commonly associated with excess alcohol consumption, although not every heavy drinker has gout. If, however, the intoxicated condition triggers a conflict of not being able to walk or not being able to balance, the development of gout is pre-programmed. Whether it affects the right or the left toe is determined by a person's handedness and to whom the self-devaluation conflict relates, to the mother, the partner, or the children. Alright, so let's try to sum this all up. What are the true causes of musculoskeletal diseases? If you know the true causes of those diseases, you will be able to apply a correct and efficient therapy, and the root causes can be classified as following. First, mechanical injuries, accidents, wrong posture at your workplace, and surgeries that cause scar tissue, muscle injuries, and accidents with tendon shortening. Second, psycho-emotional self-devaluation conflicts, and we talked a lot about those in this presentation. They are all specific for bone, muscle, lymph vessel, and lymph node, as well as blood vessel, connective tissue, and fat tissue illnesses, as they share the same brain relays and therefore the same biological conflict, namely a so-called self-devaluation conflict. The control centers are controlled from your medulla oblongata, which develop from the mesoderm. These self-devaluation conflicts can be general, affecting the whole musculoskeletal system, or are localized on a specific joint, bone, or tendon, etc. Usually, generalized self-devaluation conflicts lead to polyarthritis, rheumatism, as well as osteoporosis. Psycho-emotional, so-called muscle conflict, are specific for your gastrointestinal organs. The connection between the bones and joints on one side and the gastrointestinal organs on the other side is established through the related muscles crossing or moving the joint. Thus, many times the joints and the bone problems are due to underlying digestive organ impairments. Most of these conflicts are also controlled by the brainstem that has developed from the endoderm or from the temporal lobe. During the self-devaluation conflict active phase, the affected bone decalcifies, creating gaps and little holes in the bone. The location of the osteolysis, which is a bone breakdown, is determined by the exact type of the self-devaluation conflict, and the degree of decalcification is a result of the intensity of the self-devaluation conflict. The decalcification of the bone increases the calcium levels, and the loss of bone marrow that occurs together with the bone osteolysis alters the blood parameters. A decrease in bone mass is commonly called osteoporosis or brittle bone. Pain, reduced mobility, joints deformation, they all appear during the healing phase. If this process is interrupted by different medical procedures, relapses of the original SDC, then the rheumatism disorders become chronic. A total healing is possible only by resolving the underlying self-devaluation conflict and muscle conflicts that are related to the specific gastrointestinal organs, which are connected through different muscles to one or more joints in your body. As more traumatic therapy procedures are applied, the more intense your self-devaluation conflicts will become. So there is no cure possible if you only deal with the tissue and you do not resolve and address the psychological issues. And with that being said, thank you so much for your attention. Please like, share, and subscribe, as next week we're gonna talk about efficient therapy, holistic, of course, therapy methods for your musculoskeletal diseases that really work, how to cure those conditions, because it is, as we've said in this presentation already, absolutely curable. Not only the symptoms such as pain that you can suppress, but you can truly heal those disorders. So we're going to talk about how to heal arthritis, osteoarthritis, rheumatoid arthritis, as well as osteoporosis, and many, many more of those musculoskeletal diseases. So stick with us, subscribe so you can get the notification when the video comes out next week. And until next time, thank you very much for your attention again, and stay healthy.